Hello, everyone. It's Melissa from the Sport Fibromyalgia Network. I just wanted to jump on here, say hello, check in with everyone, see how you're doing, and also just give you a quick update, have a good conversation. One of these impromptu conversations so that we can get talking. It is Monday, September 6th. Long weekend for some, others working as well, or just hopefully getting a low pain weekend in there as much as possible with everything that's happening. So, if you're tuning in live, let me know where you're tuning in from. Just drop a line and say hello. There's a lot going on for September. I was hoping it would start off a little differently. I had actually wanted to do a next update. I got my strategy kit, which I've kind of mentioned before in another conversation of doing my genetic strategy and report, but I finally got the new full kit, and I'll do a separate video of that of an unboxing when I have a little bit less brain fog going on. And kind of with that, so you'll see an update, you'll see other things. We've kind of had to push, or I've kind of had to delay some of the other interviews that were coming down the pipeline because of my own health. I have some new symptoms coming up that are so intrusive, right? That you have to address. And so that's part of our conversation today that we'll kind of get into and just have an open discussion of reflecting on our own health and what happens with our bodies and the frustration of just managing some new things that pop up when you don't really want to manage new things. And I see it around our community too with people posting and the delays in the treatments that are going on now as well. um, but it is September, so it is Pain Awareness Month, and I know there's a lot of stuff with mental health too coming through the pipeline as well, and we'll be talking and interviewing hopefully soon. I really wanted to like hit the ground running with September and have these interviews laid out. So we have some people waiting in the wings, and I appreciate their patience as we get that going. And please be patient if you are sending in messages to me through Facebook or any of our accounts, as I'm going to slowly get back to our messages. As we get back into the swing of things. So I've had to really manage some new symptoms coming up. And that's like the open conversation. First of all, it's like, how do you, sometimes we get dismissed that the symptoms are part of fibromyalgia. In my case, I definitely know that these new symptoms are not. New pain, obviously, completely stabbing pain in the upper right side of my abdomen area, so more than likely gallbladder issues, which I am going to have to address and take care of. But it's it's a cumbersome process, right? And anyone can relate to this, please leave a comment and let me know, because I know I'm not the only one that's struggling with sort of standard of care team. I was supposed to get a better standard of care team in 2020. That was the whole thing with maybe because I've been basically seeing specialists or naturopathic doctors, but I was doing a lot of consultations with people maybe out of the state, so nothing local. So if something like this happened with like outside of fibromyalgia or acute pain, it's like, okay, so who was I supposed to go to? So I was in the midst of searching for some sort of primary care physician that was open-minded to this process, and I didn't get a chance to find that person. So now I'm managing something new that needs that. And then here's the toss up right now, especially with what's going on right now with the pandemic and slow times to get into appointments. People are packed and trying to get an ultrasound. It's a delay. So I have an ultrasound scheduled for next Monday. But you can't just like get in there. I mean, you have to go through other means, and urgent care, as I found out, could not run an ultrasound. They have X-ray capabilities, so they were deferring me to the ER. And do you really want to go to the ER right now? These are questions. And like, what can the ER do for you when it comes to these situations? So I was really trying to do a lot of research. And this is, if this type of stuff is coming up with you, I've seen some other people, some of our other advocates be posting like something new, trying to get an appointment, trying to get in, trying to get what's going on and figure it out. This is quite the challenge. And then, of course, how it disrupts our life. I mean, it's already frustrating managing fibromyalgia, and then you have something completely new. So how are you supposed to get things done when this stuff jumps up and comes up? And everybody talks about self-care, but I think it needs to have a twist on how we deliver the self-care message. Because if you do have a lot of things going on, especially those of you who are single parents, managing a household, so kids are going back to school. Like, where does self-care really fit in for you? And how are you doing with self-care and how we talk about it? I mean, even if it's 5 minutes for yourself, does that come up in your conversation with yourself? How are you taking care of yourself? And these are things, and with these delayed new symptoms, like are we avoiding it more because of the pandemic? I mean, these are questions it's just posing, and if anyone wants to chime in and leave comments or what you're going about it. I mean, are you just jumping in and then going to like the ER or calling your doctor right away, or you have some hesitancy with addressing it and seeing if if it goes away? So that's actually what I tried to do. I was like, whoa, where is this stabbing pain coming from? Um, can I kind of deal with it on my own? Is this a one-time thing? So I waited it out. I did, and it just kept getting worse. It has gotten worse with a lot of other additional symptoms to be like, okay, I gotta go. So we made an appointment with the doctors and all this stuff, and we're going through the rigmarole. But I personally struggle with standard of care. So this has always been my conflict, even like running an organization and preferencing all the videos, right? I'm not a medical provider. So medical advice, please consult with your medical provider. But I think even that, it made me think about changing the language to that, right? So the first thing maybe to do is just dig into some education pieces and then come up with a plan that you think would work for you, and then go consult with your medical provider. Because I'm a biohacker. I mean, standard of care let me down. Even functional medicine providers, it was just always here supplements, 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 and they didn't get better. I had to really figure out my own plan for myself. So where does that put me in the bracket of getting care? And I applaud everyone out there and all the providers who are really open-minded and working with you. If you have found that um, great provider that's able to work with you, like, let's celebrate you. And it's really important. I'm on the other side of it where it's just like standard of care, like people that are covered under insurance for affordability issues, which I need, are not as they're not versed in managing fibromyalgia or autoimmune conditions, and so having an in-between diagnosis puts me in a weird spot as well. So you're not sick enough to go here, but you're scaling the wall to like get worse, but we don't know what to do with you, basically. So you're kind of left on your own, and this is my situation exactly. So when something new like this happens, it's I don't even know who to necessarily turn to. So trying to figure it out, like, do I delay care a little bit? And so finally it had to get worse where I was like, okay, so I need to see a medical professional specialist, which I did. And call in the GI specialist and let's run the test. Let's get a conclusion of what's actually going on, and then we'll work it from there. But even that point too, even from my side, it's working the problem in a different way. Because if you read stuff just specifically on gallbladder, there's so much disagreement on how to address it with a standard of care versus like naturopathic medicine and functional medicine on like what to do. So as patients, like, if we do take in that knowledge and we can decipher what to do, I think the best approach would be to come up with some of our own plan, come up with our questions, and then approach the doctors to do our consultations when it comes to how we approach our own healthcare if we can. But if anyone's out there and struggling with trying to figure that out, or if that seems really heavy duty for you, please definitely let us know, because it is hard. I mean, what do we do in these situations? And when it comes to fibromyalgia care and people not being as versed to treatment or running the tests that we need, running some extra tests to rule out other autoimmune conditions, rule out Lyme, check for EDS. Like, what are we really looking at here? So we do have to be our own advocates and get ourselves educated enough where we can ask questions and bring to the table, and then hopefully our providers are open-minded enough to be able to run through this, and sometimes run through tests that are out of pocket costs, which you really have to have a discussion about. So it's tricky. And then of course now you're like back to going to extra, like trying to figure out what extra is going on your plate for new symptoms, and then getting everything done right now when it's a lot. So that's what we've been trying to manage on the support fibromyalgia side. And I'm grateful to the people that have checked in. It's hard as an advocate because a lot of people don't check in because they think you're fine. And it gets pretty lonely on this side of things, but and there's been a lot of things going on. So we did make sure that we coordinated with what we could for getting extra resources to people who were affected by Ida. So I hope for those of you that can check in that you got your resources because I was getting messages. And we did our best to try to. Luckily, I had a friend going in from Texas who was on the Red Cross team. So I gave some names and information that we could get people back some resources, but it's hard. I'm noticing as an organization to try to serve our community when stuff like this pops up, um, how tricky it is. Because if you don't have the resources in advance, how do we get you the resources specific? And I know you need the resources and serving the community. And it was something that we were trying to do at the beginning of the year as a collective, working with other organizations in different states to try to organize it. So if we had advocates in particular states, we would try to figure out how to get those resources to them in advance so that they could distribute from a ground level. But with floods and it's hard because you can't exactly send an Instacart or send an Amazon package overnight with the delivery system being changed. So this is a challenge. And if anyone has other ideas on coordination, I would love to hear them. I know Crystal reached out to me about our New York and New Jersey friends as well. So I think it's an open discussion that we also need to have, changing like how do we support all of you when this stuff happens, because I know we've been sending out resources to people who have moved because of fires in California. At least there's locations there we can get resources to, but it was very challenging to try to figure out how to get resources to people in flooded zone areas, especially with no power. What to do with resources when I mean, no internet, cell phones are dying, and it's definitely been a challenge. But we want to know that we're out there, we're putting together plans, but we need to maybe reminds me we need to coordinate resources with government resources and make sure it's well known that people with chronic illnesses are taken care of. Because I know it's different. People are giving different advice on ice packs to take care of any medication that you need refrigerated, but what's the backup plan and what resources do people have? What resources do you need? Do people have backup generators that they can put together when these things happen? So these are things we've been doing for since Ida hit to try to get resources. Now I think we're going to continue to look at that heavier when it comes and see if we can coordinate with some other organizations as well. I think that was the big thing that we're trying to do with other organizations, to mobilize these resources and go in, because we can't as advocates individually do this on our own. So we have to mobilize a team of people that can send in different resources, whether it's blankets, water, whatever we can to our communities, because it's super important. And we definitely know that it's difficult for all of us to like leave the house, move, vacate, evacuate. And it's not what we want to do. And making sure you have the resources is super important. So, reach out, keep reaching out. I'm gonna go through my messages. I'm gonna get caught up. Still have to deal with this. I think it's gallbladder. I'll know probably shortly in the next couple of weeks what exactly is going on. I had thought maybe it's a hiatal hernia, but it really looks like it's gallbladder issues for me. So troubleshooting what that looks like, but I'll keep you guys updated for 2 weeks. But please just hang in there. Like I said, reach out. I'm going to get caught up on all my comments and messages soon. Shortly, it's going to take a little bit more time than usual, and we will be back with some interviews. So people are waiting patiently for that. Going to talk about the strategy and unboxing. I'm going to go through the nutrition as planned and just keep posted if anyone needs anything. Let me just check in with the comments really quick. Hi, Denise. Great to see you again. I'm glad that you're feeling a little bit sense of normalcy. So I'll definitely, we got to check in with you and have a good discussion about just how this goes and how to manage all the stuff we're feeling. And I like what you said, not to feel guilty when my body says to take a nap. Exactly. But it's like, even I can relate to yeah, but what do you do when there's a lot of stuff on your plate or you can't? Like I've heard from so many families too that are, kids, or now if someone got sick in the family, like what does that look like and how do you take breaks when it comes to managing your fibromyalgia? It just seems like or I don't know. I feel like I'm constantly being in a vigilant state right now, especially with what's going on. So getting things done and sorting things out. So I've had to make a lot of different we use Trello board for organization for our work related stuff. So we're creating Trello boards for household thing and just taking one day at a time, or maybe if I get one thing done, because I have a lot of stuff. I haven't even announced to you guys I'm doing my recertification for Apollo Health. I'm actually also taking a certification through an institute when it comes to chronic pain. So I'm getting my master's in chronic pain certificate. I'm interested to know how they talk about fibromyalgia. So I have some school stuff, work stuff going on that I'm trying to manage. So it's so interruptive, right? You want your body to cooperate, and you're like, dang, I got to get this stuff done. And yeah, just like, it's easy to get really frustrated. And then, what I'm trying not to do is fall back into, okay, so I got to love my body and work with my body with what's going on and do the self-talk that's kind, right? We can't forget that because we're always, we may start cursing at our body for like all these things, get really frustrated, but it's like, okay, we're going to roll with this. We're going to see what we can do to better manage it, maybe lay off, can't do, 3 hours at the computer straight, kind of break up my day a little bit differently and take a look at it. But I think that's what it's a good example of what it can be. So we just take it one day at a time. So that's what you said. And thanks, Denise. It's one. I like this. I like this. I'm looking at 5 loads of laundry. Promise you, not going to. So I'm going to do one load. There you go. So one thing at a time, pace ourselves. So I love this. So that's what we kind of have to do. I know it's frustrating. I know a lot of people can relate to this. So one thing at a time, even though it seems like there's a ton of things. I got to clean my desk, right? I got to do laundry. I have loads of laundry. So it's all just, it starts to feel like it piles up, right, in your mind, and how you can sort it out, go one thing by one, just what our energy can do without creating a flare, right? Because we still need to get stuff done, but we don't want to crash. Because then if we crash, it just delays us getting stuff done too. So what does that look like in our lives? And this is interesting. So, people definitely please leave your comments, chime in on any tricks. I know we have some bloggers out there that have written good content on that. I'll try to grab it in when I can, when I update this video. But take care of yourselves out there. I just wanted to check in with you, let you know what's going on, let you know, not ignoring your messages. I have to go through a lot of messages. We've just been taking care of figuring out how to get resources to people who have been affected by Ida. Thank goodness we are members of Costco Business and Amazon Business. So we've been able to try and attempt to get larger sources to community groups out there. And I've been working with people like community health workers who are on the ground floor. But if you're an organization out there that has been giving resources to people during these times, please reach out, because we need to expand that. So we have the means to try to coordinate sending you some resources. But since we're based in California, we've been working, and it's easier to get people directly stuff like, how do we do this? How do we navigate it? So we would love to know of people in the actual field, just network with different people in these states, in the different states that are considerably effective. Like, I think we've been reaching out to a lot of people in Florida, Texas. So just establishing more organizations that are helping in these other states, Louisiana, Mississippi, New Jersey, New York. So anything we can do, we're here to help. And I will be reaching out to many of you soon, and you'll be hearing more updates soon. We'll get these live streams going as soon as possible. Thank you. Please take care of yourselves. Low pain, do what you can, I know, and reach out when you need it. And we'll talk to you later. Bye.